Hello, everyone, and good afternoon. I'm Tony Shi, President of United Hospital Fund. On behalf of UHF, our Board Chair, John Simons, and today's event chair, Carrie Kravitz, I'm very pleased to welcome you to the Tribute to Excellence in Healthcare, Recognizing Quality Improvement Champions. Of course, we all wish we were together in person for this celebration, but we do have a very special program planned, and I'm delighted to report that we have excellent virtual attendance today from the healthcare community across the tri-state area. Before we get started with our program, I would like to acknowledge the very difficult time our region and our healthcare community have been experiencing over the past several months. The COVID-19 pandemic has touched every aspect of our lives and has challenged the region's healthcare system as never before in modern times. As a country, we're also grappling with our legacy of racism and the resultant persistent disparities in health outcomes, including COVID-19 outcomes. At the same time, we have seen the great strengths and extraordinary commitment of our healthcare workforce. Please join me now for a moment of silence in recognition of all the people who have died from COVID-19, including healthcare professionals across our tri-state region, throughout the country and the world. Thank you. Today, we are very proud to recognize 63 outstanding honorees singled out by the leadership of 57 hospitals and health systems, long-term care facilities, home care organizations, and independent practice associations in New York, New Jersey, and Connecticut. Today's honorees are extraordinary individuals who have distinguished themselves for their tireless work to drive improvements across the full continuum of patient care. A bit later in our program, following our special keynote address from Dr. Shantanu Agrawal, we will highlight the important accomplishments of each of today's honorees, and we'll also hear some reflections from each of them. We are very grateful to the organizations that have provided generous support for today's Tribute to Excellence. First, a special thank you to TD Bank. Funds donated through the TD Charitable Foundation for this tribute will support UHF's Quality Institute, which is working to improve the quality, patient experience, and efficiency of healthcare delivery. Emmett Conlin, Head of Institutional Healthcare and Higher Education at TD Bank, and a number of his staff are joining us for today's event, and we're so pleased to have them with us. Thank you also to today's supporter at the leader level, Hearst. And to our benefactors, the American Hospital Association and Greater New York Hospital Association. And to our patrons, supporters, and donors. Finally, thanks to all of our generous supporters who are listed in today's event journal. You all have received the electronic version of the journal, and you will receive a hard copy in the days to come. Today's celebration of healthcare excellence is part of United Hospital Fund's broader work to build a more effective healthcare system. Many of you are very familiar with our work, but for those who aren't, we focus on three central challenges facing healthcare. First, coverage and access. Just before the pandemic hit, more than 1 million people across our region were uninsured, and countless others, even with insurance, struggled to pay medical bills. Today, many more have lost coverage as they have lost their jobs. UHF's independent analysis and program initiatives support efforts to achieve universal, affordable, and comprehensive health insurance coverage. Second, quality of care. UHF employs a wide range of strategies in the quality arena, and we are proud to be working with many provider organizations across the region on our shared goal of advancing quality and patient safety. Indeed, this tribute today was created to recognize and nourish the often unrecognized work that all of you do. And the third focus area for UHF is clinical community partnerships. We all know that social and economic stressors affect healthcare and health status, but the pandemic has brought this truth home in the most wrenching way. Our initiatives are fostering collaborations between the healthcare system and the community to address these social determinants of health, which have a disproportionate impact on communities of color, the result of systemic racism in our country. I truly believe UHF's work has never been more important, and we are grateful to our many partners in this work. I am now pleased to introduce today's keynote speaker, Dr. Shantanu Agrawal, one of our nation's most respected quality improvement leaders. Dr. Agrawal is the President and Chief Executive Officer of the National Quality Forum, which is a Washington, D.C. based, not-for-profit, nonpartisan membership organization that works to catalyze improvements in healthcare. NQF has had a foundational role in many of the honoree projects that we'll hear about today. Dr. Agrawal is a board-certified emergency medicine physician who has worked in both academic and community settings. He is the former Deputy Administrator for the Centers for Medicare and Medicaid Services, where he led an effort to improve the physician experience with Medicare, and was one of the main architects of CMS's strategy and action plan to address the national opioid crisis. Dr. Agrawal does have some New York ties. He's a graduate of Weill Cornell Medical College, and we're honored to have him with us today. Welcome, Dr. Agrawal.
Thank you for the opportunity to speak with you all today. I'd like to thank Tony Shi and the rest of the UHF team for this invitation. United Hospital Foundation and the National Quality Forum have had a long relationship together. Former UHF President Jim Talon served on the Federal Presidential Planning Committee that actually created NQF. So this is a great honor for me, and I applaud the work of the award recipients today. I'm amazed by the variety and depth of the work that is being recognized. In many ways, your achievements tell the story of the relentless and wide-ranging pursuit of quality. You are working on national priorities of the most urgent need, which is very consistent with our focus at NQF as well. You are working to improve care in specific clinical arenas, such as cardiovascular health, cancer health, the ICU and critical care, surgery, maternal and child health, behavioral health and substance use disorder, end-of-life and palliative care, sepsis, and infectious disease. You are focusing on core safety issues such as adverse event reporting, hospital-acquired infections, and falls. You are working on the health of populations and addressing disparities, including geriatric and frail elderly care and immigrant health. You are thinking about the use and applicability of technology. You are focusing on value and contributing to this important national dialogue by reducing admissions and readmissions and helping to inform new payment models. And you are addressing core organizational issues that are necessary for real advancements in quality, culture change, becoming a high reliability organization, and focusing on patient experience. This breadth demonstrates the wide-ranging importance of the quality enterprise. There is a lot of good work and outcomes to highlight. I want to mention two projects that work to improve the functional status and independence of children with complex care needs. Andrew Sosa at Elizabeth Seton Children's Center used the 3D printer and other engineering approaches to adapt equipment for chronically ill children, no doubt changing and enhancing their lives. And for the record, I've never used the word 3D printer and quality improvement in the same sentence. I look forward to seeing how much more of our modern technology tools can be leveraged for the improvement of patient care and lives. Bency Matthew at St. Mary's Healthcare System for Children utilized a comprehensive restorative nursing approach to address the same population. Not to be outdone, Bency 3D printed the nurses involved in this project. I'm kidding, I don't want to get in trouble with any nurses. Jennifer Leiter at NYU Langone executed a project that is very germane to our world today. She worked to address a measles outbreak in New York City by directly treating patients and working to ensure there was no healthcare-associated transmission. This work in particular further highlights the breadth of quality, ranging from epidemiological analysis to operational changes, and training of other health professionals and the public. Jennifer also worked to impact the broader policy discussion around vaccination rates. These are exactly the skills we need today to address the COVID-19 pandemic. The body of this work makes me proud. It should make you proud because of the community of other champions around you. When Tony asked me to give this speech, he said it was important to address the importance of quality and quality improvement work. I'm happy to do that any time. Let's be clear. Nothing is more central to our healthcare system than quality. Nothing should be a greater focus of the system than the quality of care it delivers. We spend a lot of time discussing other issues, reimbursement rates, volume, vertical integration, and these are important issues, but they are secondary to assessing the care we are providing. We sometimes lose this focus in our work. Healthcare is a large and expensive national investment. We spend more on healthcare in the United States than any other developed country. And so this field is full of a cacophony of voices, pushing and pulling on our policies, standing in sometimes diametric opposition to each other, vying for personal or industry gain. I've spent the last 10 years of my career working on health policy, and I beg us to take a different approach. Can we not put aside our parochial interests and solve for a system that treats each of us and our families the way we would want to be treated? A treatment approach that respects our individuality, our personhood, our worth as human beings, and designs policies around those concerns, not necessarily the loudest, most valued, or well-heeled voices. My wife needed surgery earlier this year. We've generally been fortunate in our medical needs. We're both physicians. Actually, we met in college and went to medical school and residency together. And it's true, she did better than me at every stage. She is the smarter one, and both of us know it. But don't tell her I said that. We have not needed much medical care beyond the usual checkups. And then we found out my wife needed surgery for a common condition, but one that had to be treated. And this made us nervous, despite the fact that we're both physicians who know how great the system can be and how common the procedure is. It scared us because we also know when the system fails, when surgeries go wrong, when infections or other preventable conditions occur, when we do not follow evidence-based guidelines or best practices. The system continues to fail or fall short too often. I know you've seen the data. Despite having the most expensive healthcare system, the United States ranks last overall among 11 industrialized countries on measures of health system quality, efficiency, access to care, equity, and healthy lives. Over 250,000 Americans still die every year from medical errors, making it the third leading cause of death, exceeded only by heart disease and cancer. This is why what you do is important. You are a sentinel for quality. You are the driving force in your system to make sure that we are striving for excellence for every single patient, every single day, even those patients who cannot advocate for themselves. You help to ensure that patients do not become a statistic, but that they have equal worth and equal opportunity for healthy lives. Our focus at NQF is building on gains we have all made together. From 2010 to 2014, 87,000 lives were saved through a decrease in adverse events at U.S. hospitals. And over a 16-year period, from 2000 to 2016, more than 2/3 of patient safety measures were improved. We have to go beyond this data to the point where every patient, every family member knows they will receive high-quality, high-value care. We have to make that the norm of American healthcare. About 5 months ago, I could have ended the speech here. Thanks, you're the best, keep it up. And then the COVID-19 pandemic happened. If ever there has been any question about the value of your work and the importance of quality, let's consider it settled. We have seen in every newspaper, on every TV screen, on every social media site, the picture of heroism in healthcare. We have seen clinicians head to work to face an unknown threat, a seemingly insurmountable challenge, at great risk to themselves and their families. We have lined the streets applauding their efforts. We have seen clinicians upend their lives so they could respond to their duty. And we have thanked them with our hearts because sometimes their children were not permitted to greet them with hugs. And we have seen clinicians suffer, bearing the burden of what they were seeing, of what they were treating. We've seen clinicians die. We've seen them take their own lives. I know we all have suffered alongside them and their families. Let us never question the heroism of people in our field. We have responded to this crisis by staying true to our ideals, to our oath, and to our profession. Let us ask a different question. Why in 21st century America, why with our technological advances and our expertise, why do we still need heroes in the healthcare system? Why do we have the temerity to ask our clinicians to step in harm's way without enough protective equipment, without adequate testing, without enough support? What we have seen over the last few months is that our system relies on day-to-day heroism and sacrifice of its workers in order to function, and that is what I challenge. We learned in 1999 that the US healthcare system poses dangers for our patients. The Institute of Medicine published the Hallmark Report, To Err is Human, cataloging our shortcomings and challenging us to do better. This is why the National Quality Forum exists. What I believe we have learned this year more clearly than before, and far beyond our discussion of clinician burnout, is that the system is also a danger for our providers. I'm an emergency medicine physician, and I can think of many times in my clinical training and practice when the system or hospital I worked in was overwhelmed, when we had too many patients in the waiting room, when we had too many ambulances arriving, when the trauma bay was full, when we had patients in the hallway and at times we had to code people there. I know each of you has seen situations like this, and how does the system respond? By expecting each of us to step up, be a hero, do more, work harder, and maintain our quality at every moment. The system is built on the foundation of exceptional and heroic contribution. It's time to ask if this is right. Shouldn't the foundation of our healthcare system be predicated on teams of people at all levels, administrative and clinical, working together? Shouldn't the system use resources to protect the health of populations and prepare for the worst? Shouldn't we have an integrated response when our healthcare system is tested? It's time to expect better on this front as well, and I implore you all to play a leadership role. We have to recognize that healthcare is not like every other business. It needs to be integrated. It needs to work together and prepare for the future. It needs to prepare for the worst. We need a culture of excellence that stops valorizing individual contribution and prioritizes collective, team-based, comprehensive response. It's time to actually build a system of care, an integrated whole that allows for local, regional, and national response to our most pressing and urgent issues. I believe you can create that system. I cannot let the topic of our COVID-19 response pass without discussing social justice and racial justice. We have known for far too long that the successes of our system, the gains all of us are dedicated to achieving every day, are not equally distributed. Black and Latino patients lag their white counterparts in about 40% of quality measures. Racial and ethnic minorities are subject to less accurate diagnoses, access to fewer treatment options, less pain management, and worse clinical outcomes across most domains: preventative care, chronic disease management, hospitalization and rehospitalization, obstetric care, behavioral health care, even mortality. This is also true within the four walls of the hospital, when external or social factors would not be expected to play a major role. COVID-19 has laid bare these disparities. African American patients are disproportionately represented among those who become ill with this disease, and those who die as a result. Early data shows a mortality rate 3 to 5 times higher than their white peers from COVID-19. We no doubt need to analyze data to understand what is driving these disparities, but even the data is currently so incomplete or of such poor quality that insights are challenging to glean. Still, let's be honest about what we know. Disparities and implicit bias in healthcare existed long before COVID-19. Addressing disparities was identified as a goal of the quality movement more than 20 years ago, and our progress has been slow and insufficient. Our healthcare system must take ownership of our contributions to the problem. The reality is that healthcare is staffed by individuals who are purveyors of social constructs and beliefs, both positive and negative. Bias and prejudice are as much a part of healthcare workers as in the general population. Because healthcare workers are in positions of authority, the impact on health outcomes can be significant and long-lasting. Have we institutionalized bias in our healthcare system? Are we seeing the same vestiges of racism in our disparities data that people are protesting against? The answer is almost certainly yes. I need you to take action and lead the charge towards eliminating disparities. We cannot be a just society without it. And without equitable care, we cannot demonstrate that to us, yes, Black lives do matter. I hope you enjoy this day and this ceremony. You all deserve this honor in having your work highlighted. Your work and your effort represent the future of our health and healthcare system. So bask in the glory, drink it in, and then get back to work. There's a lot left to be done, and I'm looking to your leadership and achievement. Thank you.
Thank you very much, Dr. Agrawal, for those powerful, challenging, and inspiring comments, and for your leadership to eliminate health disparities and ensure equitable, high-quality healthcare for all. I'm now pleased to introduce our event chair, Carrie Kravit, who will begin our award presentation. Carrie is the president of Kravit Incorporated, the luxury home furnishings and fabric company. He is a board member of United Hospital Fund and a trustee of Northwell Health, where he serves on their executive committee and chairs their quality committee.
Thank you, Tony, and good afternoon, everyone. I am very pleased to chair today's event to honor the impressive and inspiring individuals whose vision and accomplishments are driving quality improvement in healthcare. Today's gathering is both a celebration of personal leadership and an occasion to amplify and elevate the vital work underway to make our healthcare system more patient-focused, outcome-driven, safe, and effective. Each honoree was selected for their vision and accomplishment by a senior executive at your organization. Each of you has set yourself apart through your efforts to develop and spread best practices, improve efficiency, ensure patient safety, reduce racial and socioeconomic health disparities, and respond to the needs and concerns of patients as well as their families. By recognizing your achievements, we hope to nurture the vision and leadership that are essential to quality improvement and to inspire others to follow in your footsteps. We do have special awards for each of you, which you will soon receive in the mail. And you will also receive a Quality Champion lapel pin, which we hope you will wear with pride. Let me say a few things about all of you, all of our honorees as a group, before we describe your individual achievements and hear directly from you. Today's honorees represent each of the 5 boroughs of New York City, as well as Long Island, Westchester, the Hudson Valley, New Jersey, and Connecticut. You are doctors and nurses, epidemiologists and social workers, public health and infection control experts, and clinical and management leaders. You are tackling some of healthcare's toughest and most intractable problems, and you are making measurable progress, which is very exciting. You are reducing infections and preventing hospital readmissions. You are implementing electronic medical record systems, preventing patient falls and injuries, and improving safety in the operating room. The nominations we received from your institutions and organizations were sent to us prior to the COVID-19 pandemic, and I know that you all have risen to meet many new COVID-related challenges, such as caring for COVID patients and protecting your healthcare workforce during this very challenging time. Let me take a moment to read just a few ways the nominators from your organizations described you. She is a natural leader of people and a gifted change agent. He is one of those unsung heroes who should be recognized. She has persevered despite some resistance from colleagues and shifted the culture of our organization to support new and better workflows. His calm, yet reassuring demeanor and overarching commitment to excellence have raised the bar for clinical quality at our institution. Her leadership style is very focused and disciplined, and yet also extremely generous. She is a bold and tireless advocate for patient safety. She will work with any team member at any time and at any place to address safety concerns. Each of you has an impressive and inspiring story behind your work. We will now describe the work for which each of you is being honored, and we will have the pleasure of hearing briefly from each of you directly. We asked each honoree to record some very brief comments, under 30 seconds, about what inspired their work, or what key lessons they learned, or what advice they have to share with others tackling similar work. So, ladies and gentlemen, it is now my honor to give our Quality Improvement Champions, today's honorees, center stage. Thank you.
Noelle M. Aikman for reducing the number of cesarean births by over 25% through provider education, data transparency, careful review of patient cases, reinforcement of guidelines, and effective counseling.
The main lessons I've learned from my quality improvement work are to face down the naysayers, engage people through education, open discussion, and teamwork, be open to others' ideas, suggestions, and thoughts, and to not be afraid to fail, to just go in, do what needs to be done, and know that if something is worthwhile, people will eventually see the good and buy in.
Herbert M. Archer for reducing readmission rates for pneumonia by targeting 3 areas: use of evidence-based practices in managing pneumonia, a special focus on the highest risk patients, and improving care for patients with dysphagia and aspiration risk.
I think my advice for others tackling a similar project would be to follow the evidence and the data, and to leave assumptions behind when you're examining the data. Make it a truly scientific effort, because in our case with aspiration pneumonia, it was only when we relied on the evidence that we identified this as a major opportunity and an area for improvement in our management of pneumonia.
Donna Armelino for reducing hospital-acquired infections and making her health system one of the first in the U.S. to implement an innovative video and audio recording project to improve safety in the operating room.
Video monitoring of healthcare teams and quantifying elements of safety provides data. The video measures delivery of care compared to an established standard. The confidential aggregate data on the team's performance in the operating arena facilitates ongoing discussion towards collective improvements. I just want to thank those in the operating room that has made this a success. It is the nurses, the surgical technicians, surgeons, and environmental staff. It's been a pleasure to work with this team.
Paulette Bainbridge for leading projects that have reduced pressure injuries and falls, ensuring that all departments understand how to implement new quality standards, and for empowering physician champions to lead performance improvement projects.
The program that I looked at in much detail was the falls prevention program. This was, the inspiration was because of the high risk of falls in hospitals, especially rehabilitation hospitals. The goal of rehabilitation is to get a patient up and moving. So patients are definitely at higher risk for falls. So the project was to look at those indicators that would help us to identify patients who were at higher risk for falls, so we could put in falls preventive measures to minimize the fall rates.
Utica M. Belfield for leading changes in culture, workflow, and data collection that allowed the medical group to become a patient-centered medical home, and for a project addressing cultural challenges when managing diabetes.
My advice to others who are looking to find and eliminate healthcare disparities would be to first recognize that healthcare disparities may exist in unexpected places. They may be found in places where overall the numbers show that we're doing well for our patients, but a one-size-fits-all approach may lead to some patients receiving inadequate primary interventions or preventative care, or interventions after diseases have been found. So my advice is, once a disparity is found, we should do our best to do a root cause analysis and eliminate the disparity.
Judith J. Berger, for overseeing successful efforts to decrease the rates of several types of hospital-acquired infections, and for promoting a culture of engagement and transparency.
The patient's well-being inspires me, bringing all departments to the table to figure out how to get it done brings about a collaborative effort that contributes to our success. I share this award with the entire infection control department and the dedicated healthcare workers at the St. Barnabas Health System.
Jacinth V. Blackman, for leading efforts to reduce pressure injuries, which resulted in improved patient outcomes and cost savings, and leading efforts to reduce post-operative sepsis, which improved the hospital's Leapfrog Group and Vizient ratings.
One cannot underestimate the power of doing quality improvement work with cross-functional and diverse teams. The perspectives that team members bring to problem solving and process redesign is immense. I would like to share this award with all of the valiant frontline staff at my hospital for their selflessness during the pandemic.
Anthony Boutin, for improving patient quality throughout the hospital by consolidating units and increasing staffing ratios, extending clinic hours, and making the dental clinic more accessible by expanding the types of insurance accepted. Adam R. Brenner, for ensuring that critically ill patients and their families understand the risks and benefits of performing tracheostomies versus receiving palliative care, which has dramatically reduced the number of tracheostomies, and for leading an early mobility program.
The motivation for this project came from a desire to improve upon what I feel is a very important service for families and loved ones who have or are unfortunately reaching the end of their lives, and regardless of what their ultimate decisions are, ensure that all options are explained realistically, but also in a compassionate way that all human beings deserve.
Ruth E. Cardiello, for promoting occurrence reporting, developing an anonymous safety hotline, and celebrating staff who anticipate potential safety events, resulting in a 70% increase in occurrence reporting and an improved safety culture.
Our safety hotline was driven largely by stakeholder feedback or need for an anonymous reporting tool. Risk management, patient safety, quality improvement are all at their core require a shift in culture and guiding and supporting that shift. And I'm proud to say we've achieved that here at Stanford. I'm also very honored to be nominated, certainly with so many other wonderful nominees, and to serve with my 3,600 colleagues at Stanford Health.
Karen Carey, for spearheading a sepsis care initiative, which assessed current practices, analyzed data, removed barriers, and implemented interventions, all of which resulted in improved compliance with protocols and reduced length of stay for patients with sepsis.
This award really belongs to the IMC team, and I thank them and my CEO, Lorraine Brown, for their full support with this project. My advice for others tackling a similar project is start with building a diverse team. Use a collaborative approach and remain open to suggestions. Each discipline brings a different perspective to the initiative. With consistent data analysis and open communication, the goals will be achieved and have a positive impact on patient care. Again, I thank you.
Virginia Conicelli, for maintaining high standards of infection prevention and control, and in particular for decreasing the rate of C. difficile infections through effective leadership, engaging the team in problem identification, implementing best practices, and improving workflows.
Success in C. difficile reduction from 8.92 in 2017 to 3.24 in 2019 taught a few valuable lessons. Integrate new team members and try new approaches to gain insight to the problem. Provide visual cues, improve workflows, and empower nurses to incorporate new guidance. Sustain improvement. Talk about successes both daily and through presentation of data at hospital quality and infection prevention committees. Thank you.
Mary Lou O. Corpus, for leading projects that have reduced catheter-associated urinary tract infections, central line-associated bloodstream infections, and C. difficile infections, and for inspiring hundreds of residents and students to become change leaders.
One of the lessons that I've learned is about the importance of communications. Everyone in the CLAMC team has something to offer and should be heard. The team members should be talking to each other so that there's one message, one group mentality. This also translates to when we roll out any change in practice that we want to implement. Communication to the medical units and to the frontline workers, whether via email, phone, or directly talking to them. It is important to talk to them so that they get buy-in into the project. Now, this is very important.
Terry Coyle, for reducing readmission rates for adults with behavioral health needs through better sharing of clinical information, ensuring patients meet outpatient providers before discharge, timely follow-up appointments, and outreach to no-shows.
My advice to others is that meaningful quality projects are across disciplines and departments. The first objective in leading a quality improvement project is to develop and communicate a unifying vision for the team. A vision that connects the team to purpose, which is often, how are my patients going to benefit from this improvement? Once that vision is established and the team is all moving in the same direction, the rest of it, the process, the data collection, and the monitoring, that becomes the easy part.
Karen DiLorenzo, for leading the hospital's efforts that decreased catheter-associated urinary tract infections by 85% and that led to a significant decrease in patient falls with moderate or severe injury.
Looking at each of the issues from all perspectives, the patient, the direct care staff, and the providers, is what helps our team improve outcomes. We use validated evidence, provide education, we continuously monitor our progress, and that's really important. We hold each other accountable, which is even more important, and we make changes along the way as we analyze and learn from our efforts. It's truly an honor to have our work recognized, and on behalf of our incredible NYU team, thank you.
Tracy L. Dowlett, for improving quality and patient safety by implementing an electronic occurrence reporting application and developing a multidisciplinary approach to reviewing adverse events, near misses, and unsafe conditions.
And my advice for anyone tackling a similar project is to employ the frontline staff. Quality improvement projects affects them as much as it affects the patients, so you really want to hear what they have to say. They know their patients and the community better than anyone else does.
Elizabeth A. Duthie, for strengthening collaboration between senior leaders and frontline staff through a new patient safety committee and a resource center that works with staff after adverse events to identify and redesign flawed systems.
In developing a structure to connect the frontline staff to senior leaders for patient safety, my greatest concern was that the staff would be reluctant to share when things were not going well in front of their bosses. So it was a very unexpected and heartwarming experience when the shared values around doing good instead of looking good prevailed. I believe this is because senior leaders created a safe space for shared learning when things go wrong.
Lagrimas Linda Fausto, for optimizing the flow of patients through the hospital, resulting in better anticipation of bed demand surges, more attention to elderly patients awaiting beds, and reduced incidence of pressure injuries.
Define your scope, define your objectives, involve all the stakeholders, embrace your failures, embrace your wins, make sure everybody's on the same page by developing standard work, communicate, partner with IT. Most importantly, on set and during the whole entire execution of the project, you must have support from senior leaders. And lastly, you must celebrate, like tonight. Thank you so much.
Robin J. Gitman, for advancing a culture of safety by creating a Patient Safety and Quality Fellowship, a Medical Resident Quality Council, a resident-driven adverse events database, and a resident peer review process within a Just Culture framework.
The inspiration for our patient safety work has been the dedication of our teams of residents, fellows, and faculty. It's been a pleasure to lead them to accomplish the change we have. We've done it through articulating a clear vision and advocating for it over years and years of time, building coalitions across the organization, including our labor partners, presenting our proposals from not only a clinical and educational perspective, but the regulatory and the business perspective as well, being situationally aware of opportunities and taking them, and making sure that every opportunity we had counted for multiple endpoints.
Robert C. Goldstein, for instituting a successful central line infection reduction project, as well as an antibiotic stewardship program and wound care program at the hospital and its connected nursing home.
Thank you so much for this honor. Rock on, healthcare heroes. My piece of advice for others would be to make sure you have good baseline data and a good plan on data collection going forward. Thanks so much.
Darcy Harris, for leading a team that achieved a greater than 50% increase in compliance with the CMS Sepsis Early Management Bundle to facilitate the effective and timely delivery of high-quality sepsis care.
Hi, thank you for this honor. My advice for anyone tackling a similar project would be to remember that your colleagues are your most valuable asset. Lead by example, be respectful, be open-minded, be patient, set your metrics and goals of success early and your scope. Be comfortable with failure and uncertainty, which is inevitable, and enjoy the process.
Scott R. Horn, for helping countless parents whose children need surgery by producing an educational video to explain exactly what they can expect during their child's experience in the operating room, during anesthesia, and in the recovery room.
I would like to thank the United Hospital Fund for recognizing my quality improvement project. With the tremendous support of my hospital leadership at New York Eye and Ear of Mount Sinai and the input of clinical leaders, our nursing team, ancillary staff, as well as members of the Department of Anesthesia, we were able to capture and create a videotape to help reduce anxiety and stress for families that bring their children through our hospital for surgery.
Mark P. Jarrett, for promoting a culture of safety across the organization, resulting in infection and mortality rates that are below national and state benchmarks, and receiving the American Hospital Association Quest for Quality Award for the health system.
Thank you, United Hospital Fund, for this award. Thank you to the Northwell leadership for nominating me for this award, but thanks mostly to the 72,000 Northwell team members who help me every day by making sure quality and safety are preeminent in our health system.
Rita A. German and Edward F. Lundy, for transforming care for more than 1,000 heart failure patients through consultation, a new focus on safe implementation of left ventricle assist devices, and a new team approach for patients with cardiogenic shock. Besher Kabak, for creating multidisciplinary medical rounds, and for implementing protocols that have dramatically reduced the time patients spend on ventilators, and that have improved therapeutic hypothermia for cardiac arrest patients.
My advice to people tackling similar projects to the ones I worked on to include the ICU staff from nursing to therapists and preparing for these projects. Their contributions were amazing and they helped big time planning and implementing all the projects we worked on. Thank you.
Karan Devi Kandia, for serving as a physician champion dedicated to making things happen in clinical quality improvement, and for ensuring the organization is a leader in geriatric and palliative care.
The clinical care team had discussion with patients and caregivers about disease trajectories and prognosis. They facilitated person-centric decision-making regarding desired level of care, which is not only congruent with person's disease trajectories, but also consistent with belief system and wishes.
Olka Kothari, for employing quality improvement strategies, including integrating pediatric behavioral health and pulmonology within a patient-centered medical home, and therefore improving access to care and health outcomes for a vulnerable immigrant pediatric population.
Thank you so much, United Hospital Fund, for recognizing the work that my team and I have done at NYU Winthrop, and congratulations to my fellow honorees. My inspiration for this project has been the people that I work with, their passion, their commitment. All I had to bring in simply was QI methodology and data-driven approach to processes, and we've had some awesome results within the community that we serve. So thank you so much again, and congratulations to all.
Frank Licciardi, for co-founding the Cancer Center's Family Advisory Council for Quality, a partnership of current and former patients, caregivers, and staff that works to ensure that the patient and family voice is integrated into all initiatives.
My advice for others tackling a similar project is to be bold and have clarity of vision. You will never know what you could have accomplished if you don't start from a point of authentic aspiration. Being bold will propel you to the starting line, and the clarity of vision will be what enables you to persevere and get you across the finish line.
Jennifer Leiter, for her expertise during the 2018-19 measles outbreak, identifying, isolating, and transporting at-risk patients, mitigating risk from hospital visitors to vulnerable patients, and educating clinicians and patients.
I just want to thank you for this recognition. I really appreciate it. Going through the measles outbreak in some ways prepared me for the COVID outbreak, so I guess it goes without saying that whenever there are moments we have to step up and work hard, there's always something to be gained and learned. Thanks.
Mary Ellen Lindros, for reducing patient falls by engaging patients and their families in risk assessment and the development of individualized fall prevention plans.
The most unexpected thing that I learned from this project was how stimulating and exciting it can be to be involved in a large multi-center improvement project, and how staff involvement is so critical to that plan. Drawing on the wisdom of the bedside nurse and reflecting back to that nurse for shared learning has created a strong sense of collaboration and teamwork that has brought us joy. Our results have been extraordinary and were highlighted at a national conference. But to us, it is all about making a difference in the lives of our patients, and it doesn't get better than that.
Robert Lanegro, for developing a network of accessible specialty providers, better transitions between specialists and primary care physicians, and a 24/7 center to address urgent patient care needs.
I'm thrilled to be here in receipt of this prestigious recognition. But really, it doesn't go to me. It goes to all of the dedicated professionals I work with on a day-to-day basis who've dedicated themselves to helping improve the lives of the 200,000 members that we serve throughout all of New York City and Long Island. On behalf of all of them, thank you.
Steve Marzo, for effectively preparing the health system for all external quality, regulatory, and compliance reviews, and for working with engineers, architects, and others to ensure all new construction is designed to deliver optimal care.
The inspiration for my work is helping to provide an environment of care that's safe, functional, and comfortable for our patients and our staff. By working with design professionals such as architects and engineers, and of course our clinical staff, we are able to not only comply with regulations and accreditation standards, but also provide an environment that's conducive for patient care. Thank you.
Seema Masand, for prioritizing quality improvement across 36 primary and specialty care physician offices, developing educational materials on quality goals, and using new tools to track performance on quality measures.
The main lesson I have learned from the project I did during my quality improvement work is that collaboration and innovation are crucial for the success of an organization. Last year, multiple teams got together to create a dashboard that reports on dozens of metrics in real time. This innovative system highlights the efforts our clinicians put in day-to-day in caring for their patients and also encourages discussions as a team. I am proud to be a part of this family of healthcare professionals at ACPNY, where we take pride in the quality of care we provide.
Bency Matthew, for developing a new restorative nursing program to help children with complex medical conditions to live as independently and safely as possible and improve their ambulation, range of motion, and daily living activities.
At St. Mary's, we were able to successfully launch a restorative nursing program with collaboration with the rehabilitation department and support from the medical team. The goal for this program was to ensure that we can optimize functionality within our neurologically impaired residents and improve their quality of life. Thank you.
Joseph P. Matthew, for directing simulation-based educational initiatives that have improved the confidence and competence of a wide range of clinicians and decreased complications of various procedures such as central line replacement.
One of the unexpected lessons from this, that even though our process improvement was geared towards Mount Sinai West, to the ICU specifically, and the education revolved around our pulmonary critical care fellows, a lot of effects trickled down to even our faculty members and even other campuses where our fellows rotate. My advice for others tackling other QI projects are to really keep things simple. Start with a needs assessment, get buy-in from staff, follow the IHI PDSA model, and keep healthcare simulation as a tool in your toolbox.
Brian R. McMahon, for developing 2 initiatives that help identify children with depression, anxiety, ADHD, eating disorders, suicidal tendencies, and other mental health problems, and connect them with immediate behavioral health services.
I'd like to thank the United Hospital Fund for this award, period. I really shouldn't be accepting it alone, but I accept it on behalf of the Department of Pediatrics and Richmond Medical Center. We are here to serve the community, and to the degree that we listen to the community and what they need and what their wants are, then we will be fulfilling our mission.
Marie K. Moss, for leading a team that designed and implemented a project that reduced the facility-wide C. difficile infection rate from a pre-intervention rate of 5.6 in 2015 to less than 1% in 2019.
I think the most important lesson I learned from this project was the importance of teamwork, of working as a multidisciplinary team and getting an infection off the ground and working. I'd like to thank Dr. Waleed Javed, my IP team, Ilka Herbison and Jordan Eny, Dr. Jeremy Bold, Dr. Barbara Barnett, Dr. Bethany Krenitsky, Christine Mahoney, and Maria Latrace, and all the frontline nurses and nurse managers who really made this project a success.
Sharon L. Narducci, for leading a strategic plan that organizes metrics for all departments under 4 pillars: safe and appropriate care, patient experience, team experience, and efficiency, and uses color codes to highlight performance in each area.
My advice for others tackling a similar project: you must have at least 2 things. You must have strong leadership support. Thank you, Bruce Plans, Sabir Raouf, William Lynch, and Robert Levine. You must also have an effective PI coach to execute a network project of this magnitude. Thank you, Letha Walters and Helen Cohn. I am honored to be chosen as the Quality Improvement Champion for Medisys Healthcare. Thank you.
Donna Nucci, for helping her team achieve an 80% reduction in colorectal surgery site infections through a 7-element prevention bundle involving all phases of perioperative care and a stop-the-line culture to promote compliance.
We worked with teams right from our CEO down to every level of the operating room to change the continuum of care. The buy-in I had from every person that touched the patient really was transformational. We were able to decrease our surgical and site infections from a level that we felt was really unsatisfactory to be over 1 year and 2 months without a colon surgical site infection. A patient who comes to our delivery network now is ensured to have best practices in place 100% of the time. It's been inspirational to work with my team.
Kathleen T. O'Leary, for reducing serious safety events by 80% through a program that trained 23,000 staff and physicians, a new event evaluation system, rigorous root cause analysis, a daily huddle program, and a disclosure program for medical errors. Beth Oliver, for leading quality initiatives in the cardiovascular service that have significantly reduced heart failure readmissions and that have resulted in recognition such as the Beacon Award from the American Association of Critical Care Nurses.
The most unexpected thing that I learned was how this project strengthened MD and RN collaboration, further exemplifying the health system value of teamwork within our service line. Across disciplines, we share the mutual goal of providing excellence in patient care, especially during these trying times. This mutual goal provided us with a strong framework to successfully collaborate as a team in order to accomplish continuous process improvement, excel in our quality metrics, and create innovative processes of care within Mount Sinai Heart.
Michael I. Oppenheim, for ensuring that the system's electronic health record provides real-time data to support clinicians' delivery of the highest quality care, as well as for establishing and co-chairing the HIT Patient Safety Committee.
The main lesson that I've learned from chairing the Health IT Safety Committee is that reported health IT safety events are rarely one-time events. And this is true for hospital safety and quality universally, but a single standardized EMR system across multiple hospitals means that any risks introduced by the technology are multiplied on a large scale. So we treat each case as the tip of an iceberg.
Timothy Pang, for advising the New York State Department of Health and Deloitte on developing a new Medicaid long-term care payment model that more accurately ensures appropriate payments for plans serving frail and complex beneficiaries. Marion Riggins, for leading performance improvement, risk management, patient safety, and patient satisfaction initiatives, as well as educational programs on quality improvement for trustees and staff during her 25-year career at the health system.
In my 30 years as a quality management professional, there have been many lessons learned. At the top of that list would be the value of effective communication. In the quality role, one of the key things that we do is to educate. Second would be the importance of strategizing and planning. Those are very critical skills for time and resource management.
Michael L. Rink, for implementing a daily operational safety brief that allows all units to report on their staffing assessment, patient volume, safety events, equipment, and other needs, resulting in an enhanced sense of community across the institution.
The thing I learned most from doing quality improvement is to trust the front line. They've got all the answers, they all have great ideas, and we really should follow where they're leading us. It's really an honor to be part of this group, and thank you so much.
Linda A. Russell, for her passionate advocacy to promote osteoporosis and metabolic bone health, and for leading efforts to develop preoperative weight loss, diabetes management, and smoking cessation programs to promote better surgical outcomes and recovery.
The inspiration for this project came with the realization that at HSS we have a lot of patients undergoing elective surgery. Part of our mission is to improve the quality of life of our patients, and it is important preoperatively to optimize their health and aim for better post-surgical outcomes.
Lynette Rutherford, for increasing patient satisfaction and reducing rehospitalizations through a certified nurse assistant concierge program upon admission, and having a nurse educator to follow patients during their stay and for 30 days post-discharge.
I just want to tell you what my inspiration was to developing this new program that led to this award. It was twofold: to decrease our hospital readmission rate for our short-term residents, as well as to enhance resident satisfaction. The program was a huge success in helping to enhance the residents' quality of life and overall satisfaction, as well as reducing the likelihood of readmission to the hospital. Thank you so much for this award.
Dolores Shealy, for improving end-of-life care through a project to customize care kits for newly admitted patients based on the nurse's assessment and to incorporate an in-depth evaluation of pain scales and pain relief after medication.
Our performance improvement project involves individualizing the emergency care kits that we provide to our patients. The inspiration for the project was to keep our promise to our patients to provide them with the best symptom management possible. Thank you.
Mary Ann Schmidt, for transforming organizational culture, making great strides toward becoming a high reliability organization, and building safer processes of care by creating an environment where staff report and analyze errors and vulnerabilities.
In my many years working in healthcare quality, I've recognized that the frontline staff know the true issues that are affecting quality and safety for our patients, and by far the best equipped to develop solutions on how to fix them. They are the true inspiration for this project, and making them feel safe in a just culture and via an electronic platform where they could partner with the organization to develop safer systems has been truly inspirational and rewarding. So kudos to all our frontline staff and our true healthcare heroes.
Adi Sharma, for launching a physician-led, multidisciplinary, team-based approach in the critical care units, resulting in improved patient outcomes, coordination of care services, and expedited times for bed assignments.
I was asked what inspired me to take on this critical care project, and there were two elements at play here. The first was a desire to reduce unwarranted variability, a long-standing goal in healthcare and especially important for our critically ill patients. The second, another long-standing goal, was to improve communication and enhance the team-based care model for critically ill patients. By reducing the number of physicians available in the critical care unit and enhancing that team care model, we were able to accomplish both.
Samantha Silverstein, for leading an enhanced recovery after surgery program that has led to dramatic reductions in post-operative pneumonia, venous thromboembolism, harm events, and overall surgical morbidity.
My inspiration for our enhanced recovery after surgery program was our patients themselves. I think it's easy to get lost in the numbers when we focus only on the data, but data is key in making improvements. So through implementation, we didn't just look for positive trends in the numbers, we wanted to know at the patient level that they had the best possible outcomes. And so it was with each patient's success that we learned about that really helped us to drive our expansion to now 11 different services and procedures.
Sally A. Sobolewski, for improving the agency's quality of care to 4 stars on the CMS scale and achieving top national metrics in timely start of care, medication management, ambulation, and pain control.
One of the main lessons I learned early in my quality improvement journey came through the words of Paul Batalden, a leader in improvement science. He says everyone in healthcare has 2 jobs, to do their job and to continually improve their job. This is how I've approached my work, by engaging the hearts and the minds of those who make patient care happen so that quality can be embedded in the entire organization.
Andrew R. Sosa, for designing modifications to equipment used by the center's medically complex and technology-dependent children and young adults, improving their mobility, independence, and quality of life.
The most unexpected thing for me would be just how few things are available off the shelf that are ready and optimized for kids who have medical complex needs. And so they really need just little bit of customization or optimization really goes a long way. My advice will be to just really continue to learn and to try different things and embrace change and to never stop trying new technology or just new things and providing the best solutions you can for the people that you work with.
Daniela Stephen, for creating a nurse-driven delirium risk detection and reduction program, which resulted in increased staff, patient, and caregiver knowledge about delirium, lower delirium rates, and a 39% reduction in falls in patients 65 and older.
My advice for others tackling a similar project is to make sure the clinicians carrying out the work are involved in as much of the implementation as possible. This would include providing regular insight as to how things are progressing. This might call for defining and sharing process metrics if your outcome data is naturally delayed. Having frontline clinicians, in this case nurses and PAs, closely involved in the process creation and providing feedback helps to empower staff and makes for a much more sustainable program.
Yoko Tajimi, for ensuring that the rate of residents who are maintaining appropriate body weight is above state and national benchmarks by using a model that helps clinicians address changes in weight and medical status more quickly. Ramon Talaj, for leadership in improving the quality of care in vulnerable communities, including an asthma project that improved medication adherence and disease management and led to impressive declines in hospital use.
Thank you for this award to the United Hospital Funds. We are trying very hard in Somos Community Care to improve the quality of care in our poor communities. Due to the inequity that has been there for a long time, diseases like asthma, hypertension, diabetes are still very high in the incidence and getting a lot of problems to our community. With this award, we will assure you is incentivize all the personnel, all the doctors in Somos to continue doing the job for the good of our communities. Thank you one more time.
Myrna S. Tantiado, for leading quality improvement programs throughout her 36-year career at the medical center, which have resulted in recognition from organizations including the American Heart Association and the American Stroke Association.
Lesson learned from one of my mentors in quality is to remember not to expect change if nothing was changed. How do you foster change, improvement, and sustain success in QI project? Things that work for me are the following. Have the power of data by providing unit-specific report, showcase best practices, circle back real-time reviews and ask for team feedback, and lastly, celebrate success, give team players reward and recognition.
Yafa Unger, for leading efforts to improve coding and documentation, which have improved outcomes in areas such as rehospitalizations, pressure ulcer care, medication management, vaccination rates, and physical therapy outcomes.
I've found some common themes over my years working in long-term care. First, it is critical to involve all levels of the team. When we collaborate and hear each other's voices, we learn information and gain perspectives which are often surprising and always valuable. This is key to success. Secondly, when implementing a change, we need to embed it into a process. This is true particularly in large organizations. We celebrate creativity and flexibility as we serve our communities with a person-centered approach. Yet it is a consistent, well-understood practice that is the second key to success.
Usha Venugopal, for chairing the partnership between the hospital and physicians union, leading 9 separate quality improvement projects, and preparing physician residents to become quality leaders.
The main lesson I've learned from my QI projects is perseverance. Expect the unexpected, expect there to be setbacks, and learn from them. I've made so many friends in all the departments, and I've learned the work that they do. This has not only improved the quality of work that we provide through the quality improvement projects, but it has also helped me become a better team leader and a member. I really want to thank all my mentors and the peers and all those friends for this honor.
Bonita Waits, for spearheading a chronic care management program serving frail elderly patients, which provides team-based, around-the-clock care management services and prevents frequent emergency room visits and hospitalizations.
And what we did, we created a care plan for the patients, and it was tailored to satisfy their needs, their goals, and their values. And it's been very successful, and right now we have about 10 to 12 patients on this program, and they are doing fantastic. Thank you.
Zhao Hui Huang, for promoting healthy growth and development of his pediatric and young adult patients, and for employing strategies to ensure quality in the practice, such as provider reminders, quality gap alerts, and patient health education reminders.
I feel greatly honored to be recognized for this award. The good quality performance has helped us with reliable and cost-effective healthcare delivery and improved our patient outcomes. As a pediatrician, I'm so happy to see my patient getting good care. I would like to thank all of support from CAPA management and all CAPA doctors. Thank you.
Jessica M. Wares, for creating a project to reduce rates of psychotropic drug use, which involved multidisciplinary team reviews of quality measures related to prescribing these medications and resulted in residents experiencing a better quality of life.
Good afternoon. My advice to anyone wanting to complete a similar project would be to ensure that you have an interdisciplinary team, because each discipline has their own set of interventions, a different perspective, different relationships with the resident. And then I would try to involve the resident and their family, find out what the history is, what the challenges have been, and what may have worked in the past. Good luck. Thank you.
Congratulations to all our honorees. Let's give each other a round of applause. Please know how proud we are to honor you for your work and your leadership. It's a never-ending challenge to consistently deliver the highest quality of care. A sincere thank you to our honorees for the important work you are doing. You are changing healthcare for the better, and hearing each of your accomplishments leaves us all feeling hopeful that more positive change lies ahead. I will bring our event to a close with a request that our honorees stay in touch with UHF and with one another. The work you are doing requires persistence as well as vision. We hope this tribute will help nurture a professional network of quality improvement leaders across the metropolitan area, so you can support each other and learn from each other. And now I leave you with a standing invitation to join us next year in New York City, so that we can acknowledge your leadership in person and so that you can hear the gratitude and applause of your peers and admirers firsthand. Thank you again to our guest speaker, Dr. Shantanu Agrawal, for being with us and helping United Hospital Fund convey the importance of these awards. And thank you everyone for joining us today and supporting United Hospital Fund. Your support is an affirmation of the importance of the work the honorees are doing. Have a great day, everyone.